Bismillahirrahmanirrahim. My name is Salat Naz, and dear students, today we will start a new topic, hemostasis and blood clotting cascades. Objectives. By the end of this lecture, students should be able to understand what is hemorrhage, what is hemostasis, and how it play a role in management of hemorrhage. What are the steps in the mechanism of hemostasis? What is blood coagulation? What is thrombosis? And what are different bleeding disorders? And what are the causes of the bleeding disorders? So, before I start hemostasis, I would like to discuss about the hemorrhage. Whenever there is prolonged or uncontrolled bleeding, it is often referred to as hemorrhage. This bleeding can be internal or external. In simple language, hemorrhage is when the blood escapes from the veins or the other blood vessels, but it is very common in the veins. The escape of the blood may happen because of various reasons such as injury, low platelet count, threatened abortion, cancer, surgery, any sort of liver disease, brain trauma, and so on. So there are several reasons for the hemorrhage. Broadly, we divide the hemorrhage into two types: external hemorrhage and internal hemorrhage. External hemorrhage is known when the blood is revealed and seen outside. For example, after injury, you see that there is some bleeding outside the body. And the other type of hemorrhage is internal hemorrhage, in which bleeding is concealed and you cannot see the blood outside. For example, intracranial hematoma. In this condition, bleeding occurs inside the brain and we cannot see that there is bleeding. Another way of division of the hemorrhage is based on volume of blood loss. How much blood is lost during your hemorrhage? It can be mild when the blood loss is less than or equal to 500 ml. It can be moderate when the blood loss is 500 to 1000 ml. And it can be severe if the blood loss is more than 1 liter. And the physiological response to hemorrhage is to stop bleeding by chemical reaction, that is by the process of hemostasis. Whenever any blood vessel is ruptured, mechanism of hemostasis take place. And what is hemostasis? Hemostasis means prevention of blood loss. And this is a complete mechanism which is involve several processes, several factors we will discuss in our coming slides. Hemostasis is basically involve the following mechanisms: vasoconstriction, that is constriction of the vessel just after the damage, and then formation of platelet plug, then the formation of blood clot by the process of coagulation, which include lots of clotting factors, and then growth of fibrous tissues into the blood clot. Blood clot area means the area where the hole in the vessel is present. So there will be growth of the fibrous tissues to close the hole in the vessels permanently. So these are the four basic you can say the steps involved in the mechanism of hemostasis, and we will study all these steps one by one. First of all, there is constriction of the vessel just after the damage occurred to the blood vessel. So the constrictions means a decrease in the size. Constriction of the blood vessel reduces the blood flow from the ruptured vessel until the clot formation. So whenever there is a cut in the blood vessel, there are some mechanism take place so that the blood flow will be reduced The first step in the hemostasis is the constriction of the vessel. Constriction of the blood vessel reduces the blood flow from the ruptured vessel until the clot formation occurs. First of all, there is local myogenic spasm or the contraction of the blood vessel. That is the size of the lumen. That is, you can say the diameter of the blood vessel will be reduced automatically by the local myogenic spasm, so that the blood flow will be decreased and the loss of blood will be decreased. The other thing that contribute in the vasoconstriction is the release of vasoconstrictor substances from the traumatized tissue and the blood platelets. Particularly, thromboxane A2 is released from the platelets, and thromboplastin is released from the traumatized tissues. So these two are very potent, you can say very strong vasoconstrictors, and reduces the size of the lumen of the blood vessel, so that blood flow will be decreased. And this is in the part 1 of the hemostasis. In addition to this, the vasoconstriction is under the influence of nervous reflexes from the traumatized vessels or nearby tissues. So whenever there is bleeding, signals will go to your brain and reflexes will come and reduces the size of the lumen of the blood vessel. You can see in this picture that the diameter of the blood vessel is large at two ends, left side and right side. However, the place where the injury occurs in the vessel, the size is decreased. And in the lower picture, you can see how the vessel is constricted at the place of the damage. So when the size of the lumen is decreased, less blood will be flow from that part. As a result, there will be less loss of the blood from the ruptured vessel. So the first important part of the hemostasis is the constriction of the vessel. And the second important thing that play important role in the hemostasis is the platelet plug formation. You must know what are platelets. Platelets are a special type of the cells present in your blood, and platelet plug formation included three steps. First of all, platelet adherence, and then platelet activation, and then platelet aggregation. Most of the time, small holes in the blood vessel usually sealed by the platelet plug formation. You know, the blood vessels, like capillaries, are so thin, so delicate that they become damaged several times in a day. And the hole in these blood vessels is sealed by the platelet plug formation, and there is no need for the clot formation. So the platelet plug formation is very important for the normal continuation of the circulatory system. So let's discuss about how the platelet plug is formed. So the mechanism include, first of all, we have VonWillbrand factor attached with exposed collagen in the damaged vessel wall. In the whole lecture, we will discuss about several factors. So don't be confused with that. You have to memorize the names of these factors. Participate in each step of the hemostasis. So the first one is the VonWillbrand factor, which is okay. I'll tell you something about the VonWillbrand factor. It is usually present in your plasma in low concentration, but it can released from your endothelial cells. Endothelial cells are the cells that make your capillaries or the blood vessels. So the von Willebrand factor is basically formed and released from the endothelial cells, as well as they are also released from the platelets. So whenever there is a stimulus, von Willebrand factor will be released in large quantity. And what will be the stimulus for the von Willebrand factor? The stimulus is the collagen of the damaged vessel. Usually the collagen is not exposed in the blood vessel, but whenever there is damage or injury in the blood vessel, collagen of the blood vessel will be exposed. As a result, what happened? Von-Willebrand factor attached with the exposed collagen in the damaged blood vessel. The second thing that occur during the platelet plug formation is the platelets get attached with both von-Willebrand factor as well as to the collagen. Platelets change its shape. They become abnormal in shape, or you can say they take the shape of amoeba. Like they have some pseudopods that appears from the platelets, so that they can be sticky, they can be attached with the whole area where the blood vessel is damaged. As a result, what happened when the platelets become attached with the von Willebrand factor and collagen, they change their shape, they become sticky and adhere at the damaged area. As well as what the platelets do, platelets release multiple active factors. Particularly the important factors at this step is the ADP and thromboxane A2. ADP and thromboxane A2 then activate nearby platelets. In the blood there are lots of platelets, but these platelets are not activated. So the ADP and thromboxane A2 that is released by the platelets which are already attached to the damaged area. So these two factors activate the other platelets, and as a result what happened? They get adhere to the damaged area. So hence the platelet plug is formed. So what we see in the platelet plug formation, we see that whenever there is damage to the blood vessel, first of all, the von Willebrand factor which is present in the plasma, as well as the platelets which are already present in the plasma or the blood, when they pass through the damaged area, they are attracted towards the collagen, only to the exposed collagen. So when the von Willebrand factor attached to the collagen and the platelets sometimes attach directly to the collagen, as well as they also attach to the von Willebrand factor. So in this way there is a huge quantity of platelets that attached with the damaged area. In addition to this, platelets release ADP and thromboxane A2, which further activate the nearby platelets and adhere to the original activated platelets, means that are attached to the already to the damaged area, and some other platelets which are passing into the blood vessel, into the blood, they also get attached to the damaged area. As a result, large quantity of platelets come into one place, and this is known as platelet plug. In this figure you can see this is the von Willebrand factor. Okay, this is the collagen. These are the endothelial cells. In the endothelial cells, a large quantity of von Willebrand factor is stored. So von Willebrand factor not only released from these endothelial cells but also from the platelets. So the huge quantity of von Willebrand, you see, this is the von Willebrand black dots. These are now attached to the collagen. The nearby platelets which are passing into the blood vessel. This is a blood vessel. You see this is a blood vessel, and there are lots of platelets over there. But initially these platelets are not attaching to the endothelial cells because there is no damage. But once there is damage, these platelets are attracted towards the collagen as well as to the von Willebrand factor. As a result, you see there is adherence, there is collection, there is attachment of the platelets over here, so that they will stop the blood. For example, this is a blood vessel, and there is lots of blood cells that can come out of the damaged area. So what the platelets do? They adhere at this place and try to stop the blood. And in the small capillaries, this plugging is enough to stop the blood. You see, these are the endothelial cells, and this is the collagen which is exposed after the damage. And these are the platelets. You see, from the endothelial cells and from the platelets, von Willebrand factor is released. Okay, this is released, and this is the endothelial cell. These are the platelets. So VonWillbrand factor has the receptors for the platelets. So platelets will attach to this VonWillbrand factor. Now you see more and more platelets will come and attach to the VonWillbrand factor, as well as some platelets directly attach to the collagen, exposed collagen, and more and more platelets will come here, and they form this is called platelet adhesion. And when lots of platelets are there, this is formed the platelet plug. VonWillbrand factor also contain factor 8. Factor 8 is also important in the clotting process. We will discuss it in detail. But you know, if there is deficiency of VonWillbrand factor, there will be deficiency of factor 8. As a result, there will be more bleeding time, means clot will occur in more time and more blood loss will be occur. So the VonWillbrand factor is very important, and its deficiency cause sometimes very fatal results. Now the third step is blood coagulation. The clot begin to develop in 15 to 20 seconds if the trauma to the vessel wall is severe, and clot begin to develop in 1 to 2 minutes if the trauma is minor. What happened? Activator substances released from traumatized vascular wall, as we already discussed, VonWillbrand factor for example, or other substances are released from the traumatized vascular wall, which are also known as tissue factors. Then some substances are released from the platelets, and you know, some proteins which are already present in the blood but they are not in the activated state. All these things, that is the vascular substances released from the vascular wall, from the platelets and the inactivated proteins, all these adhere to the traumatized vascular wall and initiate the clotting process. So this picture gives you the basic idea how the clotting will take place. First step we have already discussed, vasoconstriction. The second step, which is also known as primary hemostasis, it includes the platelet adhesion, aggregation and activation. So we have already discussed how the platelet get adhesive, how sticky to the damaged collagen area, and then they will attract more and more platelets, and they become activated to release some substances. So at this stage, this is known as primary hemostasis because the platelet plug is already formed. And the third step is the release of tissue factor. This tissue factor will lead to the coagulation cascade. And the coagulation is basically the secondary hemostasis, and the step is third. So the secondary hemostasis will lead to the formation of the clot, platelet clot, stable fibrin clot. And this stable fibrin clot is very important, so that if for instance if the platelet plug is not very strong, so we need a stable and a strong clot so that the blood will not rush out of the blood vessel. So all these vasoconstriction, platelet plug formation and coagulation, all these lead to stable fibrin formation. And when the blood vessel is you can say come to the normal functioning, fibrinolysis will take place. Fibrinolysis means removal of the fibrin will take place. Fibrin will retract from this part, and the normal smooth blood vessel will be continued. Before we go to study the clotting cascades, which is the third stage of the hemostasis, we must know different names of the clotting factors, and you know, these are very important for exam point of view also, because you may be asked about name. For example, you have asked about the name of the factor 2 and its function, so it is very important. So for that I take medical mnemonics here. Foolish people try climbing long slopes after Christmas. Some people have fallen. if you remember this line and have some information about the factors, for example, factor 1, fibrinogen, it is associated with foolish. Sometimes we forget what is the factor 1, but we know the names, but we forget what is the factor 1. So, then factor 2, prothrombin, for you can memorize it with the people, foolish people. Fibrinogen, prothrombin. Factor 3, thromboplastin. Factor 4, calcium. Factor 5, labile factor. Factor 6 is not mentioned clearly, so it is not included here. Factor 7 is the stable factor. Factor 8 is anti-hemophilic factor A. Factor 9 is Christmas factor. Factor 10 is the stored power factor. Factor 11 is plasma thromboplastin antecedent. Factor 12 is Hedgeman factor. And factor 13 is fibrin stabilizing factor. So we will have a function of all these factors in the coming slides. But before that, again, we have one more important thing to discuss here. Procoagulants and anticoagulants. As we already discussed that whenever there is rupture, the process of hemostasis occurs, which means to stop the bleeding. And we already studied that the third step of hemostasis is the coagulation. Why not coagulation take place during everyday time when the blood vessels are working normally? Why only during the injury the coagulation take place? This is the reason we will discuss here. You know, more than 50 substances found in the blood that participate in the blood coagulation. Some are procoagulant and some are anticoagulant. Procoagulants promote the coagulation and anticoagulant inhibit the coagulation. You know, normally anticoagulants are predominant in the bloodstream to prevent the blood coagulation in the vessel. However, when a vessel is ruptured, procoagulants become activated and they play a role in the clot formation. So always remember, in the normal condition, when the blood is normally flowing into the blood vessel, the anticoagulants are predominant. However, when there is a ruptured vessel, the procoagulant to promote the coagulation become activated and they play important role in the clot formation. First of all, we will have a brief review. Clotting take place in 3 essential steps. Okay, we already studied about the first hemostasis. What is hemostasis? Hemostasis is a mechanism to stop the bleeding. The first step is the constriction of the blood vessel. Second step is the platelet plug formation. Now we are at the third step, that is coagulation. So, or the clotting. So, clotting takes place in 3 essential steps. First of all, there is formation of prothrombin activator. Prothrombin activator formation occurred just after the rupture of the blood vessel. The second step is the conversion of prothrombin into thrombin. Without prothrombin activator, this prothrombin, a plasma protein, which is already present in the plasma, but it is not activated. So when you have prothrombin, this prothrombin activator, this prothrombin will be activated and converted into thrombin. So prothrombin activator in the presence of calcium convert the prothrombin into thrombin, and then this thrombin convert the fibrinogen, which is insoluble protein, into fibrin fibers, and fibrin fibers are thread-like structure. So this is the basic mechanisms of the clotting. First of all, we need to form the prothrombin activator. Prothrombin activator convert the prothrombin into thrombin, and thrombin then convert the fibrinogen into fibrin fibers. You remember the definition or the basic concept of blood clot. Blood clot is composed of meshwork of fibrin fibers running in all the directions and entrapping the blood, platelets and plasma. Now, you see here in this picture, sorry, this yellow part, you see the fibrin fibers. And clot is composed of meshwork. Clot, this collection which contain of fibrin fibers as well as some blood cells as well as platelets and some portion of the plasma. This meshwork, complete meshwork is the clot. Fibrin fibers adhere to the damaged area of the blood vessel, therefore blood clot become adhere there and prevent the further blood loss. So at this part, the after the formation of the thrombin, fibrinogen converts into fibrin fibers, and these fibrin fibers are spread over there in abrupt manner. Clot after, okay, this clot is formed now. After the formation of this clot, there will be no blood loss. Okay, but we need to remove this clot so that RBCs will not face any difficulty in moving into the blood vessel. So within a few minutes, clot being to contract. This clot, which consists of the plasma, red blood cells, platelets, fibrin fibers, is become contracted and express most fluid from the clot within 20 to 60 minutes. Means the fluid portion which is present in the clot will be released from this clot portion. This fluid is termed as serum because all its fibrinogen and other clotting factors have been removed. So this is called clot retraction, and clot retraction will take place within 20 to 60 minutes so that the size of the clot will be reduced. And then there will be entry of the fibroblast which then close this part and then blood flow will be resumed. Positive feedback of clot formation. During the clot formation, there is a positive feedback mechanism. That is, once a blood clot has started to develop, it normally extends within minutes into surrounding blood. That is, clot itself initiate a positive feedback to promote more and more clotting. More important cause is thrombin proteolytic activity, which allow it to act on many clotting factors in addition to fibrinogen. What does it mean? It means that thrombin not only act on the fibrinogen to convert into fibrin fibers, but it also act on other clotting factors so that a proper clot will be formed, and it also act on prothrombin to convert into thrombin. Means thrombin not only activate the fibrinogen but also it activate itself. It also activate the prothrombin to convert into more thrombin. So when there is more thrombin, more fibrinogen will be converted to thrombin, and this cycle will continue until the clot will be formed. Now we will have a brief review about the cascades of coagulation. Up till now we have studied that for the coagulation process, prothrombin activator is very important because it converts prothrombin into thrombin, and thrombin then convert the fibrinogen into fibrin fibers. So the main thing that we need is prothrombin activator, and without prothrombin activator, clotting cascades will not be continued. Coagulation will not occur, fibrin fibers will not form, and fibrin fibers are the most important thing for the clotting. So prothrombin activator is not a single factor. However, it is a complex. Prothrombin activator is a complex or the combination of factor 10, tissue phospholipids, and factor 5. Remember, prothrombin activator is not a single factor. It is the combination of factor 10, tissue phospholipids, and factor 5. Prothrombin activator formation can be take place by two pathways: extrinsic pathway and intrinsic pathway. First of all, extrinsic pathway, it is activated by external trauma that causes the blood to escape from the vascular wall. Whenever there is trauma by the external way and blood will escape from the vascular system, extrinsic pathway will be started to form the prothrombin activator. However, in intrinsic pathway, it is activated by trauma inside the vascular system and is activated by platelets, exposed endothelium, chemicals, and collagen. Intrinsic pathway is also known as intrinsic pathway because for the intrinsic pathway, all the factors are already present into the blood. We don't need anything from the outside. That is why it is also known as intrinsic pathway. In this picture, we will discuss only about the intrinsic pathway that will lead to the formation of this complex. This complex is the prothrombin activator. Very good. Prothrombin activator is the combination of factor 10, tissue phospholipids, and factor 5. So remember prothrombin activator because it will activate the prothrombin into thrombin. Now start from here. First of all, consider there is some injury and the collagen from the blood vessel is exposed. As a result, what happened? The protein factor 12, which is already present in the blood, it become activated. Why it become activated? Because it is exposed to the collagen. Okay, when factor 12 is exposed to the collagen after the trauma to the blood vessel, factor 12 become activated. This activated factor 12 then act on factor 11, which is again inactivated in the blood. This inactivated factor 11 will then convert it to activated factor 11. This activated factor 11 then act on inactivated factor 9. This inactivated factor 9 will convert it to activated factor 9. And then this activated factor 9 will make a complex, means combine with factor 8, which is from where it come? It come from the VonWillbrand factor. Okay, factor 8 is coming from VonWillbrand factor, and this activated factor 9, calcium and phospholipid, all these combine together and make a complex. This complex will then convert the inactivated calcium 10 into activated calcium 10. Now you have now you have factor 10 which is in the activated state. This is the main target that we want to achieve. Now this activated factor 10 will make a combination with factor 5, calcium and phospholipid. Again, this activated factor 10 make a combination with factor 5, calcium and phospholipids. This combination is prothrombin activator. This is what? This is prothrombin activator. It will act on prothrombin and convert this prothrombin into thrombin, which is a small part of prothrombin, because prothrombin is a large molecule and it is converted to a small part, thrombin. This thrombin now act on fibrinogen, which is soluble protein in the blood, and then this is converted to insoluble fibrin fibers. Thrombin convert the fibrinogen into insoluble fibrin fibers, and these fibrin fibers are small in size. In the presence of factor 13, they convert to fibrin polymers, which are large fibers, and then these large fibers are stuck on the injured area of the blood vessel and stop the bleeding. So this is the intrinsic pathway for the formation of this prothrombin activator. Now come to the extrinsic pathway. This is the extrinsic pathway. Extrinsic pathway is basically activated with tissue factors. Tissue factors released from the injured vessel. And these tissue factors then convert inactivated factor 7 to activated factor 7. Now, after that, factor 7 is become complexed. Factor 7 with tissue factor, calcium and phospholipid. I repeat, factor 7, tissue factors which is released from the injured tissue, calcium and phospholipid, they make a complex. Then this complex will act on factor 10, and this factor 10 is converted to activated factor 10. Then again, there is prothrombin activator, which is a combination of factor 5, factor 10, calcium and phospholipids, similar to the intrinsic pathway. So this prothrombin activator, which is a complex, will act on prothrombin and convert it into thrombin, and then thrombin will act on fibrinogen, which then converted to fibrin, and then fibrin are small monomers which are then combined together and form polymers, which is a large thread-like structure and will stop the bleeding. So this is intrinsic and extrinsic pathways. Although we study them separately, but sometimes both pathways start simultaneously to form the prothrombin activator, because both pathway has a target to convert the prothrombin into thrombin and fibrinogen into fibrin. So they have to follow all the steps. But you see, intrinsic pathways stop at factor 10. The target of the intrinsic pathway is to make factor 10, and the target of the extrinsic pathway is to make the factor 10. Once the factor 10 is activated, in the presence of prothrombin activator complex, it will convert the prothrombin into thrombin, and thrombin then convert the fibrinogen into fibrin fiber, which are monomers. Fibrins are then converted to polymer, which is a large fibers or thread-like structure that are helpful in the making the clot. Conversion of fibrinogen to fibrin, formation of the clot. Fibrinogen, as I tell you, that is a protein that occurs in the plasma and formed in the liver. Thrombin act on fibrinogen and form fibrin monomer molecules. Fibrin monomer molecules combine with each other. Fibrin monomers means small size molecules. They are combined together and form a long fibrin fiber that form reticulum of the blood clot. Newly formed fibers are weak and can be broken apart easily. Within a few minutes, fibrin stabilizing factor is released by the platelets. Bleeding conditions associated with hemostasis. There are several disorders associated with the blood, but hemophilia, VonWillbrand disease, and vitamin K deficiency are the most common and most prominent associated with bleeding disorders. And in these conditions, there will be difficulty in the clotting, and the blood loss may become fatal, that can lead to the death. Hemophilia is basically of two types, type A and type B. Type A about 70% and 20% is about type B. So overall, out of 100% bleeding disorders, almost 90% is countable in the hemophilia. So hemophilia is a hereditary bleeding disorder in which patients bleed for a longer time than the normal persons after any injury. Means there will be difficulty in the clotting, and the blood remains moving out of the body. This is an X-linked recessive disorder and characterized by deficiency of coagulation factor. In hemophilia type A, there is deficiency of coagulation factor 8, and hemophilia B, which is also known as Christmas disease, there is deficiency of factor 9. As we have already discussed about the importance of factor 8 and 9, so due to the deficiency of these factors, there will be problem in the clotting, and blood loss may lead to the death. Hemophilia is also known as a royal disease, because Queen Victoria is the carrier of the disease. The pattern of transmission is like that a father is a normal person and mother is a carrier. So in the children what happened? In the first son you see X and Y both are normal. So this son is without hemophilia. However, when you go to the daughter, you see she is the carrier of the hemophilia gene because she carried this gene from the mother and this X gene from the father. So she is the carrier of the hemophilia. Now come to the son. Has hemophilia because the man receive only one X chromosome which is from the mother. So he receive X chromosome from the mother which is abnormal. So in that case he is the patient of the hemophilia. And this daughter does not carry hemophilia gene because she got this X chromosome which is normal from the mother and this X chromosome which is also normal from the father. So she has a normal life. She is not suffering from the hemophilia. During hemophilia, there can be bleeding from intra-articular, intramuscular, intraosseous, subperitoneal. The bleeding can take place, and sometimes it becomes life-threatening when there is bleeding of intracranial, thoracic, or abdominal region. There is another condition associated with bleeding is thrombosis. Thrombosis is the process of a blood clot, means the formation of a blood clot which is known as thrombus, and these clots are formed into the blood vessel. This clot can block or obstruct the blood flow in the affected area as well as cause serious complications if the clot moves to crucial part of the circulatory system such as brain or the lungs. So initially the clot is at one place and obstruct the blood vessel, but once it moves from its place, it can move to any part of the circulatory system, and if it reaches to the brain or the lungs, then the condition become lethal because it can cause the blockage or the obstruction of the blood flow in that sensitive areas. There is a condition deep vein thrombosis. Although thromboses are of different types, but I mention here the deep vein thrombosis because it is very common, and it is a medical condition that occurs when a blood clot forms in a deep vein. These clots usually develop in the lower legs, thighs, and pelvis, but they can also occur in the arm. It is important to know about deep vein thrombosis because it can happen to anybody and cause serious illness, disability, and in some cases it can lead to death. Another problem that patients are facing due to bleeding is vitamin K deficiency. You know, vitamin K is very important. Vitamin K has a role in the synthesis of several proteins that mediate both the coagulation and anticoagulation. And you know, the coagulation is so important because all day and night blood vessels are get damaged, and for the repairing we need different clotting factors. So vitamin K deficiency lead to excessive bleeding. The key vitamin K dependent proteins are coagulation proteins including factor 2, which is also known as thrombin, factor 7, factor 9, and factor 10. So these factors, coagulation proteins, are dependent on the vitamin K for their synthesis. So if the vitamin K is deficient, these factors are also deficient and can lead to bleeding disorders. Anticoagulation proteins which are dependent on vitamin K are the protein C, S, and Z. Of course, these has also a role in the anticoagulation so that blood will not clot in the normal conditions without trauma or without injury. So that anticoagulants has a potent role in the normal circulation. So they are also dependent on the vitamin K. So vitamin K is so important in the process of the hemostasis that it can lead to different deficiencies of different clotting factors and lead to the death if the bleeding is not stopped. So this is about today's lecture of hemostasis. I hope you understand each and everything. This is all for today, and I would like you to read it again, so that you have to memorize all the names of the clotting factors and how they are participating in the intrinsic and extrinsic pathways. Okay, so this is all about today's lecture. Thank you so much.